So we're going to do a lower extremity peripheral vascular exam. So typically I'd have the patient in a gown or shorts. We're just gonna have Chris roll up his pants for me, please, for the sake of just explaining how I'm going about this exam. So I'm gonna have the patient expose as much of the skin as possible, and we're gonna do a systematic inspection from the inguinal ligament down to the toes, just noting any asymmetry, weird coloring, rashes, anything unusual. And then we're going to check the temperature. So I'm going to, I'll start here and kind of work up this way, and then we'll kind of come down here, noting any changes in temperature from side to side. That would indicate something. Then we're also going to identify any trophic changes that we notice. Also, any chronic venous stasis can be observed now. And we'll look at the skin color as well as the nail color of the toes. And then we're going to do the toe compression test. So I'm going to compress his toes and check note vascularity, if we have good sufficient vascularity going to the toes. And then I'm going to check for any pitting edema at the medial malleolus. So just compressing there, also on the top of the foot, and then at the shins, noting if there's any pitting edema going on there. Those would be some good places to look to know if there's any edema. And then we're going to check the pulse. So we're going to do dorsalis pedis on the top of the foot, checking these bilaterally, and then so dorsalis pedis, and then inside the medial malleoli, we'll check for a pulse there. And then I'm going to have you flex this one up for me, please. And I'm going to, with my fingers behind the knee, check for the popliteal impulse. And then I would do the same thing on this other side. And then I would also come up to check the femoral pulse. And do so on both sides, just making sure that is normal, not anything abnormal. And then I would go on to, here we got this guy, so I would check, ideally we'd have skin exposed, and we would be checking the auscultation of the femoral artery with the bell side of my stethoscope. There we go, making sure there's no signs of bruit or anything, and I would do that bilaterally to make sure that those are normal. And then I would go on to check the lymph nodes, so horizontal along the inguinal ligament, and then the vertical lymph nodes, noting any abnormal masses. So I would do that bilaterally on both sides. Also, we could have, we could check for a hernia by placing our hand over the femoral artery, having the patient turn their head and cough for me, please. Good, and I would do that bilaterally, making sure that that feels normal. You can do that seated or laying down. And then we can go on to Hohmann signs. So I'm going to have the patient's leg raised to 45 degrees. I'm going to squeeze the calf and dorsiflex their foot. Positive sign would be if there's any pain with that, and I would do that bilaterally as well. And then we were going to do the leg elevation test. So I'm going to raise the patient's leg up to, both legs up to 60 degrees, and have them pedal their feet for about a minute. And then we would return them back after a minute and just make sure that there's the return of proper blood flow, that we notice via the color of their feet and lower extremities that that's returning right. And then we would do a venous tap test. So we would palpate, we'd have the patient standing. So if you want to stand for me quick on this one. And so the patient will stand, and you can't see it on the video, but I'll explain that I would go palpate to the long saphenous vein on the medial leg, and then right above that I would tap that, and if I can feel anything weird with that, that would indicate some venous valve incompetency. Thank you, Chris.